So welcome everyone to the Flinders NT Regional Training Hub NT Medical Careers Pathway webinar series. We'll just wait a minute or two for some of our attendees to come on board. And tonight we're joined by the Royal College of Pathologists of Australasia. So I'm very excited about hearing about careers in pathology and the training opportunities available across the country and particularly in the NT. We'll just give it a few minutes, but while we're waiting, I'll just do a little bit of Zoom housekeeping with you all. The webinar series that's coming to you through us is using the Zoom style platform. We're having 3 presenters this evening, and you'll be able to lodge some questions either via the chat box, which is the single little speech bubble icon on your screen, or via the Q&A box, which is the double speech bubble that's on the bottom of your Zoom icons. Unfortunately, those of you who are joining us as attendees won't be able to have your video or microphones on, but please feel free to introduce yourself to our panelists via the chat function if you're there. Tell us who you are, where you're from, and what you hope to get out of tonight's webinar, and we'll make sure we cover those things off for you. For those of you who are watching this as a video recording afterwards, please send any questions you have after the webinar into us at the Regional Training Hub, and we'll make sure they get answered for you. Or I'm sure throughout tonight's webinar series, there will be plenty of reminders of who to contact at the RCPA or the local specialists here in the NT. Just as a reminder, the webinar is being recorded. The final edited version will be available on the Flinders Regional Training Hub website, excuse me. Okay. Before we get too far into this evening's webinar, I would just like to pay my respects to elders past, present and emerging of the Larrakia people from the Darwin and the Greater Darwin area, who are the traditional custodians of the land from which I'm zooming from here in the top end, as are 2 of our presenters, Dr. Faru and Dr. Alex. I'd also like to pay my respects to the peoples of the Gadigal clan of the Eora Nations, which is around the Sydney area and the Greater Sydney area. And this is where Teresa from the Royal College of Pathologists of Australasia is zooming in from. For those of you who don't know me, my name's Dr. Olivia O'Donoghue. I'm a GP based here in Darwin. And I'm a medical and cultural educator and the medical director for the Top End Regional Training Hub for Flinders NT. And this webinar series, if you're joining us for the first time, is a collaboration between Flinders NT, the Regional Training Hub, Top End Health Services, the specialty colleges, and our respected NT clinicians and NT health services. As I said, today we're hearing from the Royal College of Pathologists of Australasia. Gosh, that's a tongue twister if you say it too many times in a row. And they're going to talk to us about some exciting opportunities and hands-on career pathways in training with pathology. So our presenters for this evening are Ms. Teresa Stewart, who's the Education Advisor from the college, Dr. Faru, who's a consultant pathologist in the Top End, at Top End Health Services, and a staff specialist at Royal Darwin Hospital, and Dr. Alex Laidman, who's a current trainee of the RCPA. So without further ado, I'm going to stop sharing my screen, and I'm going to hand over to Teresa Stewart, who's the Education Advisor from the Royal College of Pathologists of Australasia. Thank you very much, Teresa.
Thank you. Okay, hello everybody. Yes, as Dr. Olivia said, my name's Teresa. I'm an education advisor with the college. And I'm just going to talk to you generally today about what the college does and what the college can offer. Initially, just starting with a little bit about what is pathology. Pathology is a medical specialty concerned with the study and the nature of the causes of diseases, and it underpins every aspect of medicine, from the diagnostic, testing and monitoring of chronic diseases through to cutting-edge genetic research and even blood transfusion technology. Pathology is integral to the diagnosis in every cancer, and timely and accurate pathology results are critical to our entire medical system. Within our training pathway at the RCPA, we have a number of specialties that you can study within. You can choose anatomical pathology, chemical pathology, forensics, genetics, general pathology, hematology, immunopathology, or microbiology. So I'll explain a little bit about what each of those entails. Your anatomical pathology, or sometimes called surgical pathology, it's looking at the analysis of disease, and the findings of our anatomical pathologists are fundamental to our medical diagnosis, the management of the patients, and often research. To become an anatomical pathologist, you need to have a really keen eye for detail and a very broad base of knowledge, because they need to have a deep understanding of all clinical aspects of a big diverse range of diseases. So I will go on to chemical pathology. If you become a chemical pathologist, they're dealing with the entire range of diseases, and they really look at substances within the blood and the body fluids. So they look for changes within our body fluids. They're looking at things such as your electrolytes, enzymes and proteins. They also tend to measure and detect our cancer markers, hormones, poisons, or both illicit and therapeutic drugs. Within Australia, we've got over 1 million clinical chemical pathology tests done annually. It's a big area. A lot of it is very automated, as you can see from the picture there. Forensic pathology is an interesting area. A lot of people are interested in this. The forensic pathologists focus on the medical, legal investigations of a sudden or unexpected death. And major role of them is the performance of CT and autopsy examinations, trying to look for the cause of death. So according to Dr. David Ranson, he said, I think to be able to get to grips with what has really gone on, to solve the puzzle, to explain why someone died medically, to integrate the findings of the death scene with the findings at autopsy, and explain something that has not been explicable to other people is a tremendous challenge and very enjoyable. Then we've got our genetic pathologists. They focus on looking at the chromosomes and the DNA to diagnose genetic modifications and diseases. The training pathways, there's two different pathways you can choose within genetics, biochemical genetics or medical genomics. They're also involved in the detection and interpretation of genomic or epigenomic variants in fetuses, children and adults. They might do pedigree analysis or diagnostic assessment. Also, they might look at the detection and interpretation of mosaic genomic variants in things such as cancer, pregnancy, and there's so many different inherited diseases. Hematology, this is the area that deals with diseases affecting our blood, such as the diverse range of anemias we have. There's many different leukemias, lymphomas, clotting or bleeding disorders, as well as the management of blood transfusions. Hematologists are not only involved in the lab, but they also manage patients with blood diseases as clinical consultants. I think hematology is often a very popular choice simply because of the variety and diversity of activities undertaken by hematologists at both a lab and a clinical level. Immunopathology, this one deals with the diagnosis and monitoring of diseases in which the immune system is not behaving itself. It might either be underactive, such as in immunodeficiencies, which lead your patient to be susceptible to infection, or the possibly overactive, such as in autoimmune and allergic conditions. So our immunopathologists are involved in the design, performance, and the supervision of any tests related to the immune system. Clinical activities of the immunopathologist include providing advice on a wide variety of disorders, including recurrent miscarriages, some areas of transplant medicine. They might also be involved in managing our patients with autoimmune conditions and AIDS. So as with most of the pathologists, they have a clinical side rather than just a laboratory side, which often people think is the only way where they are. One of the biggest areas that's had a lot of publicity this year are our microbiologists. We wouldn't have been without them in 2020. Microbiologists, they study microorganisms, whether it might be bacteria, virus, fungi, parasites, any of these that cause infectious diseases and are responsible for diagnosing and treating these infectious diseases. And as I said, from this year, it's been super busy, and they're also involved in providing information into the national vaccination strategies and public health measures. Microbiologists as consultant medical practitioners will give advice about the best specimen to collect, the best test to perform. They'll give this advice to medical practitioners to help them in diagnosis and determining the cause of an infection. They'll also advise about antibiotics in collaboration with infectious diseases physicians. Lastly, you can specialise in general pathology. Our general pathologists cover the profession as a whole. They're usually trained within anatomical pathology, chemical pathology, microbiology, hematology, and blood banking, but they don't go into as much detail as the subspecialists in each field. They're more a generalist. Our general pathologists tend to work in medium-sized private practice, community hospitals, or within large country towns. However, we do have some general pathologists working within metropolitan public and private practices, particularly managing the common high volume tests from more than one discipline. So it might be a lab that does predominantly routine hematology and biochemistry, which you'll get in some of the big hospitals. And then you'll get a general pathologist that can cover both of those disciplines. So if you're interested in studying pathology, having that as your specialty, what should you do next? We have a lot of information on our RCPA website, which I've put here for you. So go to the website and have a look. Within the website, it will show you things like job listings, so that will come up with trainee positions. There's also a section on students and junior doctors to give you an idea how they can become involved or what things you might do prior to choosing. So for our prospective trainees, those of you that want to study your advanced training in pathology, before being accepted into the training program, you've got to prove that you're a registered medical practitioner. You then have to have a training position in a laboratory that's accredited by the college for training. So we have to have, usually there's fellows of the college already there and they are capable of running a training course for you. You would then submit an initial registration form to the college and a copy of your prospective training program, which you would do in conjunction with your supervisor. You're given a supervisor within your lab. Training can be done in the Northern Territory, and currently we have we have pathologists in anatomical pathology, hematology, and microbiology. So there are 3 areas of training currently available. However, over your 5 years, you're expected to do at least 12 months in an alternative laboratory. So that often might mean interstate. What would your training look like? Most programs take a minimum of 5 years and you enter after PGY2. So after your postgrad year 2, you have to do 2 years of physician training and then you would enter. Most programs have 3 exams within it. The basic pathological sciences exam, you can do that before you commence or in your first year. So many people will take your BPS within your final year of medicine. It is also a lot cheaper to do it that way, so it becomes quite common. Then you have your 2 main parts of your exam, part 1 and part 2, and that's on your discipline specialty. So part 1 is usually done in your 3rd year and part 2 is usually done in your 5th or final year. Each discipline is slightly different, so that's in general. One thing to remember that all pathology training begins in a laboratory and that's where we spend most of our time, and it requires hands-on experience So my advice to you is, as a junior medical officer, rotate into a lab if you can. If you get the chance, spend some time there, see if that's what you'd like to do. We also offer a joint training program. There's a committee of a joint training of the RCPA with the Royal Australasian College of Physicians, or RACP, where there's a combined training. This can be done within the disciplines of haematology, immunology and allergies, chemical pathology and endocrinology, microbiology and infectious diseases, clinical genetics and medical genomics. So this is like a combined, a double degree, so to like that, where you'll pick two and you'll do your fellowship in combination with the other college. If you do go this way, there's recognition of prior learning. So the first year is retrospectively accredited for completion of your basic physician training. Why would you pick pathology as a career? Okay, one of the best aspects of a career in pathology is the diversity. No day is the same. You have a wide variety of cases, so it never ceases to be interesting and challenging. Most pathologists work with a wide range of medical specialists. You're involved with everybody else, including your general practitioners and your scientists. And the work frequently involves the integration of the laboratory and clinical medicine. When compared to many other specialties, a pathologist has quite a good life balance, because within the discipline there is usually a limited amount of on-call work, leaving a lot more time for family and other interests. Also within pathology, if it's your interest, there's an opportunity to focus on research. Thank you. And that's my general overview of studying pathology with the college today. And I will stop sharing my screen now.
Thank you very much, Teresa. I just wanted to clarify one point that you made. You said there was, on application, there was a basic pathological sciences exam that you generally sit before you start training.
Yeah,
And you could sit that as early as the final year of being a student, is that correct?
that's correct. It wasn't compulsory prior to this year, but it is now for all trainees. And really it's because a lot of universities are not focusing a lot on pathology within the medical degrees anymore. So it's kind of like gives you a grounding. And a lot of people will sit the exam, even if they want to go into something different like surgery. It's just 100 multiple choice questions with a general overview of pathology. And that's sort of required to make sure people are interested, and they have to pass that. So provided you pass it before you sit your part one, that's fine. But you are able to sit it as early as your final year as a medical student.
So it's not a prerequisite for joining
It's not a
training?
prerequisite for
Okay.
joining, no.
Okay. Good. Yeah, it was interesting to hear about the combined training pathways. I was curious as to where they fit in, so thank you for clarifying that. I might hand over to Dr. Furu now to share her screen and tell us about her work and life as a pathologist in the Northern Territory. Thanks, Furu.
Okay. Thank you, Olivia, for giving me this opportunity to talk about anatomical pathology, most and my experience in NT. Hello, everyone. My name is Farouk. I'm an anatomical pathologist working as a staff specialist in Royal Darwin Hospital in Northern Territory in Darwin. As Teresa explained beautifully, there are different areas of pathology: anatomical pathology, chemical, clinical, forensic, and many other areas, which I chose anatomical pathology. It was my passion from first, and because I loved looking, you know, at the slides, specimens, make a diagnosis, and I like the way that with my diagnosis, clinician can do their management and treatment, and they can, you know, it will be a guide for them to manage their patients. Um, About my recent training and work experience in NT, I came here as an overseas trained specialist. Before that, I was a consultant anatomical pathologist for nearly 6 years. And then I sent my qualifications to the college, Royal College of Pathologists of Australasia, which I call RCPA, and they accepted actually my qualifications, and I had to have 2 years of training under supervision, and then sit the exams to get my fellowship here in Australia. So I started as a registrar here in Darwin in 2017. In first year, I sat my basic pathological sciences exam and I passed it. And then in second year, I worked as a senior registrar and I sat my part 2 exam. I was exempted from part 1 exam, so I sat all the components of part 2 exam at the same time. And then after I got my fellowship in 2019, I had this opportunity to become a consultant straight away here. So I started my work as a staff specialist here in Royal Darwin Hospital. What attracted me to train and work in NT? This position was attractive to me because it was accredited for 2 years, and I needed 2 years for training. And you know, many places they might get registrars, but they are not accredited by college. So it was a good point for here that it was accredited for 2 years. And then I was based, when you are in Darwin, you are based in a large tertiary hospital, a public hospital, and because of that, you get you get diverse cases, case mix. You can see different case mix, and then there was a good team of pathologists here, 4 pathologists, which I mean, they were young, they were experienced, and I could learn a lot from them. The other thing that attracted me to Darwin, which when I lived here, I realized that more. I think the suitability of Darwin for family life, especially when you're a registrar. Darwin is quiet, nice, not crowded. There is no traffic, and you know, believe me, when you have to work from morning to evening, and you have to you know, study for your exam, it's really a great point that you know, you don't get that much tired in, you know, commuting from work and to your home. The other thing which I can say a good thing about Darwin, I think, I mean, I've seen in my situation and on others, if you come with your family and, you know, your partner, for example, getting job in Darwin might be easier than, you know, other states. So usually your partner can also, you know, have a job. For example, my husband was a GP and he could easily get job here in Darwin. My longer term goals when I started here, at first it was receiving RCPA fellowship, which I did, and then working as a consultant here. My future goal would be narrow down my specialties to some subspecialized areas, which, for example, I like gastrointestinal pathology, dermatopathology, breast pathology, because I guess when you work as a general pathologist in a public hospital and you see everything, you can be good in many areas, but you cannot be the best, you know, in all areas. So narrowing down these subspecialties maybe help you to, you know, be more focused in just a few areas. Also, there are opportunities for, you know, research. I was always passionate about research, conducting research projects in terms of original papers and writing case reports. You know, case reports is easy to write in anatomical pathology, and there are a few research centers here which you can collaborate to write. To do some research and write some papers and improve your, you know, research footprint. Pathology education has been always an important issue for me, and here we have the opportunity. We have 2 registrars and we have teaching sessions for them, and we have teaching for medical students also. And my other goal is by improving telepathology education, I would like to transfer as a remote area. I would like to transfer our knowledge to the, you know, more remote areas. Obviously, there are some challenges and advantages of being in NT. So the challenges, I guess, it is far from major pathology centers in, you know, other states, other cities in, you know, Sydney, Melbourne, Brisbane, and sometimes traveling to conferences is a bit difficult. You know, you waste 2 days going and coming. Cost of living maybe a little bit higher, and the other thing that this is the only tertiary hospital which is accredited for training in NT. So when you are here 2 years, you don't have any rotation. But the good thing is that because this is the only hospital, we receive cases from all over NT. So there are a couple of hospitals in all over NT, which they all send their specimens to us. And we see lots of complex and advanced cases, especially, you know, different kind of cancers, infectious disease, and it is a really good thing for you know, being experienced in this area. There is a good teamwork here. We are 4 pathologists, and as I said, a mixture of young and experienced ones. And although we are remote, but we always have support from other states. We always have support from Southern Australia, Queensland, Victoria for second opinion. If there is any complex case, difficult case, which we need second opinion, we send to them, and we can use actually their experience. The other thing is, which is kind of recent, recently we managed to, for our registrars to attend the online teaching sessions from Sydney and from Brisbane. So whatever teaching sessions and exam sessions, mock exam sessions that they have in their, you know, city and hospitals, our registrar can have access to that online, and it is really good for their learning and for preparing for the exam. If you are interested in anatomical pathology and in training in this field, obviously the organization is Royal College of Pathologists of Australasia, RCPA, which if you go to the website, you can find lots of useful information. We have also International Academy of Pathology, the Australian division, which provides some educational materials, some meetings, conferences every year. About the key people to contact, Director of Pathology is Prof. Rob Baird, and Director of Anatomical Pathology is Dr. Afaq Khan, which you can find their, you know, contact and email. you're always welcome to come to pathology department, have a chat with us, have a tour and see how we work. And also, if you are interested, there are some videos in YouTube that you can look at them, you can watch them. For example, Day in the Life of Anatomical Pathology. It's kind of give you an idea how it works. These are some screenshots of pathology RCPA websites, which if you go through, you find more information, useful information about different areas of pathology. And I think this is kind of a quick summary that I can present to you. Hopefully it can help you finding your way if you are interested or passionate about pathology. And thank you for your attention. Thank you.
Thank you, Dr. Farouk. Sounds like we're very privileged to have had the opportunity to have you come and join us in the NT, and bringing along your medical family with you as well. We always need more doctors in all spaces. Yes. I do have a few questions, but sure. I think I might leave the questions until after we hear from Dr. Alex about her experiences as a trainee in the NT as well. So I'll hand over to you, Dr. Alex. Thanks.
Okay, is that working? All right.
Yes.
Yeah, beautiful. Thanks, Olivia. So, hi everyone, my name is Alex. I'm a first year laboratory haematology trainee, also known as hematopathology, here at the Royal Darwin Hospital. And today I've been asked to talk to you about pathology trainee from a trainee's perspective. To start off with, a little bit about my background and how this led me into pathology as a career path. So I'm actually new to the Northern Territory this year, and I did all of my previous medical education and work back in Western Australia. So I started off with a Bachelor of Science, which majors in genetics and pharmacology, and then did a postgraduate medical degree, all in WA. I completed my internship and my first year of residency also in WA hospitals. And during those first 2 clinical years, I had a range of specialties that I had rotations in, and I actually only had one 11-week haematology term during those 2 years. At the PGY2 level, so postgraduate year 2, you're then eligible to apply for hematopathology training with the RCPA in a number of states and territories in Australia. So that's what I did, and I was fortunate enough to be given a position at Royal Darwin Hospital. So this year I started my RCPA single discipline laboratory haematology trainee position. In terms of what sort of sparked my initial interest into the career path, there was really a number of sort of aspects that stood out both during my studies and my 2 years of clinical experience prior to training. So I was exposed to laboratory practice back in my undergraduate degrees, and I really love the aspects of diagnostic testing and laboratory methodology, although I do want to point out that you don't actually need any prior lab experience before entering pathology training, and a lot of my colleagues actually had none. I'm also a very inquisitive person, and I've always been driven to understand the cellular and molecular basis of disease. And as Teresa mentioned, it's really this fine level of detail that underpins almost all of pathology, and that's something that I really enjoy within the discipline. I also, in my first 2 years of working, really started to understand the importance of pathology as a medical field. I mean, if you think about it, how often is one of our colleagues ordering, for example, a full blood count? It's pretty much on every single patient. And in that way, I'm involved in the care of almost every single patient that comes through the hospital, which is pretty cool. So if you think about it, without high quality pathology, healthcare services wouldn't function. And although a lot of people don't think about pathology as a training pathway, it really is sort of the backbone of medicine, and it makes it really a rewarding sort of career path to go down once you're in it. As a person, I also really enjoy problem solving, and I feel like pathology lends itself really well to anyone who has that sort of drive, and particularly hematopathology I've found has a lot of problem solving in it. I also really enjoy sort of teamwork and the multidisciplinary team aspect of medicine. And as Teresa mentioned, as a pathologist, you are dealing with a number of individuals, primarily laboratory scientists, who all have their own area of specialty interest and expertise within the lab, but then you're also dealing with people, both clinicians working inside the hospital and GPs and other clinicians outside the hospital from a range of different specialties. So it really is the most multidisciplinary sort of specialization that you could get within medicine, and that's really enjoyable. Lastly, something that I found when I was looking at future career paths is the huge opportunities for research and education within the pathology field. And those are two things that I really enjoy and value. So that's something else that led me towards pathology as a career path. I just wanted to take a quick moment to sort of explain haematology training a little bit more, because this is not something that I really understood when I was coming out of med school, and I would have really appreciated knowing. So if you look at the diagram there, the middle column is what most people think about in terms of haematology training. So that's the dual trained haematology pathway, where someone will be both part of the RCPA, which is the physician training, the RCPA, which is the pathology training, but also the RACP, which is the physician training. So you start off with physician training, complete your exams, and then do another 4 years of specialty training after that, usually 2 years in clinical and 2 years in laboratory, and end up as a dual trained pathologist. The one on the very right is the pathway that you can go down when you actually are just a clinical haematologist, which is less relevant to this talk. And the pathway on the very left is the one that I've actually gone down. So that's when you are a single discipline RCPA laboratory haematology trainee, and you end up as a laboratory haematologist. And that's a 5-year training program once you've entered the training pathway. Whether you become a laboratory haematologist alone or in combination with being a clinical haematologist, as has already been mentioned, there's so many areas of subspecialization in pathology, and that's definitely true for haematology as well. So the ones listed at the bottom of the screen are really just some of them. There are so many more, and that makes pathology a really interesting area, because there's something really for everyone. And then I also just wanted to spend a quick few seconds talking about what a hematopathologist does, because that's also not something that was really sort of taught to us in medical school. You kind of only see the clinical side of hematology. So just really quickly, you are the one that's performing all the bone marrow biopsies. You also report and comment all the blood films and the bone marrows that you take. You liaise with hospital and non-hospital staff about abnormal hematology results. You give advice on blood product stock maintenance and blood product administration. You typically do a lot of clinics during your training as well, which is really good for getting a bit of the clinical aspect too. You have a lot of exposure to laboratory aspects in terms of lab management, internal and external quality assurance, and things like that, which can be quite enjoyable and you don't get really anywhere else in medicine. And at a more sort of senior trainee or consultant role, you tend to hold quite senior laboratory management roles as well. So in terms of what attracted me to train or work in the NT, so to start off with, I'd heard a lot of great reports about training, doing your first year of training at Royal Darwin Hospital in laboratory haematology. The department is used to getting first year trainees in particular, and therefore they're very welcoming, they're very patient, and they're sort of willing to teach you what is essentially a whole new language of medicine that you don't really know before starting. So for example, at the start of this year, I couldn't remember how to turn a microscope on, let alone use it to diagnose acute leukemia, and thinking about how far I've come in the last 8 months. So I report on 10 to 12 blood films and 4 to 5 bone marrows. So 10 to 12 blood films a day and 4 to 5 bone marrows a week, pretty much autonomously, but with really good supervision from my supervisor and other consultants. So that's all pretty much from the staff here, who are amazing. The territory also typically allows more autonomy from its staff, which provides greater sort of opportunities, breadth of experience and upskilling than if you're working in a more tertiary centre at a larger hospital, which has a number of consultants and a number of trainees. Having worked with Aboriginal populations back home in WA and being passionate about equity of healthcare, working in the territory also provided the ability to work with these populations and contribute to Indigenous health, which is definitely added to the job satisfaction of servicing a community and area of need as well, which is also a huge benefit of working in the NT for me. The population within the Northern Territory is also great from a pathology and also haematology perspective. So there's great clinical variety and there's a lot of challenging cases that you get in the workplace. My department itself is very supportive in terms of professional development, and I've heard that to be true of both the anatomical pathology and the micro department here as well. And of course, the attraction of the Northern Territory lifestyle and the culture of a good work-life balance is something that is massive about the Territory compared to other states within Australia. So at the bottom of this PowerPoint open at the moment are just some selfies from some of my highlights of this year. So the first two are actually my first bone marrow aspirate and trophine procedure and slides that I prepared back in March, which was huge for me and very exciting. And the last picture is my first blood group, manual blood group identification, which I did a couple of months ago. So that was really exciting. So in terms of some advantages and disadvantages of being in the NT, so to start off with from a territorial or laboratory specific advantages, so Royal Darwin Hospital is actually the referral centre for all Northern Territory hospitals. So like Faru mentioned, that brings with it a whole lot of cases and lots of interesting things. It's also the National Critical Care and Trauma Response Centre. So for haematology in particular, that brings with it a lot of massive transfusion protocols, a lot of interesting blood banking and perioperative blood management. You also get a lot of obstetric and paediatric pathology because we are the only tertiary centre within the territory. There's no specialised obstetric or paediatric hospitals, which means everything comes to us. So that's really beneficial compared to other states in Australia. It also has a really diverse population with a wide variety of patients, and I'm sure that holds true for all of the pathology disciplines, but in haematology that's meant that I've been exposed to a wide, to both malignant and non-malignant haematology conditions and a lot of unique haematology and transfusion cases as well, which you really wouldn't get anywhere else in Australia. So it's been great to have that in my first year of training. In my department, I've found that I've got high exposure to a lot of experienced staff and a really strong multidisciplinary team, and the workload I've found tends not to be as high as in the larger tertiary centres in Australia. So it's really great, particularly if you're starting off as a trainee, to sort of get your footing and your grounding as well. In terms of haematology training specific advantages, you get exposure to all of these areas that are listed there on the PowerPoint. And then secondly, the Northern Territory or the Darwin application for haematology training is actually centralised with Victoria and Tasmania. So if you're interested in possibly working in either of those two states during your 5 years of training, it is somewhat beneficial to already be part of that sort of catchment or recruitment pool. It just makes it a little bit easier in the future. In terms of some of the challenges of working in the Northern Territory. So as a hematopathology trainee at Royal Darwin, I'm actually the only laboratory trainee, and there's not actually a clinical trainee either. So the clinical ward job role is usually filled by a PPT trainee, and you can definitely bounce clinical ideas off them, but they're not within the haematology training program itself. You also share an office with the two AP trainees, which is definitely makes up for this. So you can talk about all sorts of general pathology questions with them, and they tend to be a bit more senior. So that's great as well. The second challenge that I've noticed this year is that because the Royal Darwin is a slightly smaller centre compared to other sort of states in Australia, there's a number of tests, particularly in haematology, and I'm not sure how well this holds true for other areas of pathology, that we end up sending away and we don't do in-house. So we don't do any cytogenetic, molecular or hemoglobinopathy testing. They're all sent interstate, but if you think about it, it's not really a challenge, because you're actually encouraged to spend 2 weeks in South Australia and 2 weeks in Melbourne during your year of training to get experience in those areas, and the college will actually cover your expenses to allow you to have that sort of training. So that's pretty amazing as well. In terms of my longer term career goals, so I hope to do further training at a number of different laboratories, and also include a year of training in an area of pathology that is not hematopathology, and that's something that the college recommends for all single discipline trainees. I hope to gain fellowship with the RCPA after another 4 years of training, so 5 in total. I hope to continue my involvement in teaching and research. I particularly have an interest in molecular hematology given my genetic background, so I think that's an area that I probably like to subspecialise in. And ultimately, sort of long-term career goals would be to hold a more supervisory laboratory role in an accredited lab after a number of years of being a consultant. So if you are considering pathology or haematology as a future career path, if you're considering getting some more information or possible training or exposure to haematology training at Royal Darwin Hospital, the best point of contact is probably Dr. Tina Nusos, who's actually affiliated with the university, and I'm sure you guys know quite well, and her email is on screen there. So she's definitely the best point of contact first off. If she can't help, or if there's other questions, then our head of department, Dr. Sabo, might be someone that you can contact as well. In terms of pathology training in general, as Dr. Frew and Teresa have said, the RCPA really is the best sort of point of call. Their website is great. So there's a section on the website called Becoming a Pathologist. And I looked at that a lot last year when I was considering pathology as a training specialty. And if you don't know who to go to, I've called them a number of times and they've told me who's the right person to talk to. So they're really friendly on the phone as well. So I hope this talk was not all in vain, and that I've opened some of your eyes to a potential career path in pathology. It's really rewarding and I definitely recommend it. If there's any questions that you guys have, feel free to direct them through Olivia, or you can email me as well and I'll be happy to reply. And I'm going to try and stop sharing now.
Sorry, I was on mute. I was saying thank you very much. I really appreciated the little blood cell meme. Love, yeah. I was just wondering, Alex, are you part of the NT Vic Tasmania training consortium?
Yes. Yeah, so they're all centralised. So I would have applied for all of them.
Yeah. And this is your first year of training. How much training do you hope to do in the NT?
So the NT is actually only accredited to train hematopathologists or lab hematologists for 1 year at the moment.
Okay.
So I have to move on at the end of this year. I think that was mostly put in place for dual trainees though, who only get 2 years in a lab, so they don't want you spending your entire training in Darwin because there is some areas that we don't do. So I think for future people, if you are going to do a lab only training position, then the college has sort of already expressed to me that they might be open to longer than a year, because I have 5 years in a lab. So obviously 2 or 3 years in Darwin would not be an issue. I'd still have ample time to spend time at other places as opposed to dual trainees.
Yeah. And Dr. Frew, did you say that you could do 2 years? There's 2 years accredited training in the Northern Territory in anatomical pathology? Yeah.
Yes, for anatomical pathology, 2 years.
Okay. So it varies depending on the discipline that you're undertaking with the training.
Right.
Yeah. And Teresa, you mentioned that we've got training in anatomical and hematological, but also microbiology as well?
Yeah, there was a position in microbiology as well, a trainee position. I'm not sure if they're still there now, but there was. I don't know if Alex or Faru know of them.
Yes, I think there still
Yes.
there is, and it's
Yeah.
popular.
Yeah.
Yeah.
We have one question come in about opportunities for training in forensic pathology. Is that something that's available in the NT in any way, shape or
It
form?
isn't at the moment, but it doesn't mean that it won't be further down the field, because every year the college will consider different places, and it depends on how big the forensic department is. If they have fellows, all they have to do if they're really interested is get someone from that area, that specialty, to apply for accreditation. Then that lab would be accredited, and then some time would be, if it was accredited and they had fellows that they felt could train them, then, you know, there's no reason that it wouldn't in the future be there.
And from my understanding from what everybody's sort of said is you apply for training at the same time as you've applied for a position in an accredited training position. So you kind of need to get the position and then get into training. Is that right?
Yeah. Yes. Yeah.
And forgive my naivety, it sounds like through the discussion right from the onset of training, you need to have decided what specialty area that you want to train in. So you apply to do specialty training in anatomical pathology or immunology or microbiology, or you can go down the dual training pathways as well. So I'm just wondering, from your perspective, Alex, you've shared a little bit about what made you interested in haematology, but do you have any advice for anyone who may have an inkling that they are interested in pathology training and how they would get experience in pathology to kind of narrow down the field of what specialty they would like to go into?
Yeah, so although Darwin doesn't have training positions in all of the disciplines, it pretty much does provide all of the disciplines at the hospital. So if there's particular areas that you're interested in, get in contact with the head of department, see if you can spend some work or clinical placements there. Or if you want to make it a bit more productive, they're really open to you doing research projects or audits in the area as well, which often gives you a really good idea of sort of the scope of what the department does and sort of what it's like working with them too. So that's what I did back in WA when I was considering haematology. I reached out to some of the consultants in the haematology lab, spent a couple of weeks with them, a couple of weekends with the scientists, sort of going through what it would be like to be a haematologist, and really, really enjoyed it, and then did a really sort of quick audit with them. And yeah, that's what sort of led me down haematology. But just if you're not entirely sure on the specialty that you want to go into, I mean, if you're sort of sure about pathology, you can pick one, but I have got a number of colleagues where they've started in one area, and then, as I mentioned previously, the college does encourage you to spend 1 year out of your 5 years of training in a area that is not your chosen sort of specialty. So for me, an area outside of haematology for a year, and a lot of people have actually done something else, realized that they love it even more, and then either done dual training, so extended their training a little bit longer, or you can sort of switch mid-year, switch training at the end of the year as well, and do the other sort of specialty. So I've had colleagues that have done that too.
Do you have anything to add, Dr. Faree, in terms of getting experience or expressing an interest in a career in pathology?
As I said, because pathology is a kind of, you know, not very focused on, you know, medical school. In medical school, it's not that much, you know, in focus. So medical students usually they don't have any concept about it, how it works, and So as I said, if anybody thinks that that he or she is interested, they're always welcome to our department and spend some time with us. We're always open with lab, you know, and see how it goes. You know, as a trainee, as a consultant, as you know, in if you want to work in a lab, how it goes. So I think it helps you to get some idea then that you know if you like that or not. I mean, this is the only advice I can say.
Great, thank you very much. It looks like we've lost Teresa again. I think another bandwidth issue. We lost her earlier today. So on that note, it is getting close to wrap up time for this webinar. I really have enjoyed listening to Teresa, yourself, Dr. Farouk, and Dr. Alex about careers in pathology. I must admit, I've had very limited experience liaising with pathologists in my sort of medical school years and through my junior doctor years, and now as a GP. Mostly I'm liaising with private companies and their pathologists rather than within the hospital system. But it's been really interesting to learn about all the different career pathways. And I think as a note to us at Flinders, maybe we should do some more promoting of all the different opportunities that are available, because it sounds like there's a huge amount of variety and things that are available with a combination of clinical patient contact and laboratory stuff that would be really interesting to some of our medical students and junior doctors out there. So if you have any further questions for our panellists this evening, please let us know. Either contact all the panellists on the email addresses and stuff that they have provided you this evening on their presentations, or you can contact us directly at the Regional Training Hub on our website or our email, which should be on your screen at the moment. We also have a host of career pathways information in the NT on our website, and as promised, the links to all of our webinar series will be available through our website, and those links as well. I think we're going to end for this evening tonight, so we'll leave it there. So thank you very much, Dr. Farouk. Thank you, Alex, and we'll thank Teresa in an email later when we get in contact with her. So that's a goodbye from all of us, and hopefully we've sparked some interest in training as a pathologist in future for our students and junior medical officers watching. Thank you and good night.